Hi guys, Fletch here from Running Science with Michael from MyMove again. This is number 5 on our tips. An important thing to talk about here is how we deal with niggles, pains when we're running. A lot of us have experienced when we get to 30-40 Ks and we want to do more, that we start feeling little niggles and pains in places, and I bet a lot of us have ended up having bigger injuries. What we want to talk about a little bit here is how do we stop some of those niggles and little whispers becoming problems, and what are some of the simple things we can do. Mike?
Yeah, we've spoken about the niggle board before, and when Fletch saw me, it wasn't really an injury, it was more just a pain in his knee. He could still run. We didn't want to rule him out of running, we just wanted to educate him on what he could do to stay below the injury line, which we've spoken about. A couple of things happened to Fletch. He stopped his strength training. We talk about running being a privilege, and you can't just run 40 Ks with no consequence. You have to keep up some of these things. And the two simple things with Fletch on the niggle board was soft tissue work. Once he started warming up a bit better again and doing some foam roller work, his knee was a lot looser. And the second big thing to stop his knee dropping in was the strength around his hip. So once we got his knee tracking straighter, he came back below that niggle line and he's running a lot better now. If he lets that go, he starts to get close to that injury line, especially when he goes 50-60 K, and that meniscus starts to become not irritated but torn, and then you get ruled out of running. So again, important to get your niggles sorted out early. Perfect.
I second that.